Hey Camphillers, it's the final one with the lovely Siobhan Menzies. I am so grateful because so many really interesting, professional, really experienced people come in on Cam to help you guys. So thank you, Siobhan, for giving up your time. It's really fantastic of you. Please tell us a little bit about yourself so people can have trust and faith that you know what you're talking about.
So I'm Siobhan Menzies of Holistic Pet in Northern Ireland. We're a pain management clinic. We run services in 6 practices in Northern Ireland, providing acupuncture, physiotherapy, laser therapy, therapeutic exercises, and hydrotherapy and multimodal analgesia for pet pain in Northern Ireland. And I'm also the veterinary consultant to the UK Cannabis Clinic.
Amazing. Okay, so our final episode is bringing it back to reality. We've previously talked about how it really is quite hard to advise. It's quite hard to find reliable products. We still have so much to learn. So you watching this, sat there in your onesie, in your lovely couch, and the fire's going and X Factor's on, and you've got your iPad, and you were just about to buy a product off Amazon or eBay, and you're just about to press spend, and you think, no, it just told me that this is a highly unregulated market. A lot of the products that are out there don't necessarily have what they say they've got in them. Some of them might have nothing in them. Some might have toxicities in them. You're going to pause. You didn't press buy. You now go to see your vet on Monday morning and say, I've heard about this. I really want to explore it further. How can we help that vet? And how can we help that owner? What kind of advice can we bring it all together and make it a real life experience?
Okay, so first of all, the vet will want to investigate the complaint. So if it's osteoarthritis, they may want to do x-rays. They may want to do some serum biochemistry to make sure that the liver function and kidney function is okay to tolerate the licensed medications. They will embark upon using the licensed medications as a first line of treatment. Okay, if you've used the licensed medications, the non-steroidal anti-inflammatories, and they have either helped a bit or not been tolerated by the animal, and you need something else to add to that, you may then use some off-license products that are licensed in the human world. Okay,
and let's just put in that can take a little bit of time, guys. So we're not talking within 2 weeks your vet's going to just jump onto CBD. So we know things like non-steroidals, we could be using that for 3 months to get on top of central sensation, which is a really, really bad pain experience. So don't expect your vet to just grab it, straight off within the first month. They have got a process that has got evidence of it being effective. So don't rush. Go back to you.
Absolutely. So when we've explored all of the proven licensed therapies, then we can consider a CBD product. Okay.
Right.
Now, your vet at that stage may say, hold on, I don't know enough about CBD. Okay. So there's 2 options. They could either refer them to a specialist vet who may know a bit more about CBD, or to a practice which is a member of the UK Cannabis Clinic, where the staff will have undergone training in CBD, or they may undertake the free online training available through the UK Cannabis Clinic. And through that...
So just pause there. Tell me a bit more about this, because this is really, really very new. And I must admit, a lot of the literature, the articles that I read about CBD are very much from America. There's a lot more activity, conferences, veterinary conferences, CPD, not CBD, CPD, about this. Whereas here in the UK, there's been the VMD statement, September 2018, and then there's been like a drought where you go, and now we'll tell you more about it. So what is this that is now becoming available for vets to learn more and understand more?
So at the UK Cannabis Clinic, we're trying to provide vets with education in CBD, so they understand, how it may work. They understand the research to date. Okay, they understand that you must comply with the BMD. You cannot make medicinal claims. You can only use human products. You must use a product that's THC free. So it's really giving them all of that information. Also, there's an online questionnaire where we provide them with information about the licensed products, and we then ask them questions about those licensed products. so that they get an understanding of the whole process and understanding of how CBD may work, but also the limitations in practice, the legal limitations. Okay.
And the VMD supports this training. So the VMD...
I can't say that the VMD, I can't say they support it. They have said they're happy for us to teach vets about CBD so long as we stick within their guidelines. But I would say that to say the VMD endorse it or support it is possibly, not fair to the VMD.
Yeah. But I think we're currently in a climate where all first opinion practitioners do need to have a little bit more understanding about this. I certainly have found with my own work that people will come in and they'll tell me what their dog's on and they go through it. They're like, they're almost naughty. They're almost like trying to conceal it from me, and I shouldn't tell them because they would. And we should be like that because we need to know that your dog is on it. So there is, you'll be able to do us a link to this service, so vets that are interested and to understand more can access it. Right, so we're back in the consult room. The owner's there, they've taken off their onesie, they're actually wearing clothes, put their iPad down, and they're with the vet, and the vet has been for your training or they've done some extra reading. They have tried, and they've got a diagnosis, they've gone through the recognised, respected, evidence-based treatment plans, and they've come to the decision that it is acceptable to try CBD, and they're now looking for a human food supplement. Where do you go then?
Well, that's again, the UK Cannabis Clinic provides a safe, reliable route to a pharmacy grade product for vets. So it's a sister company, Canadol Pharmaceuticals, produces pharmacy grade CBD products for use on prescription only. So regardless of whether it's a two-legged animal, a human, or a four-legged animal, the Canadol treat CBD as a medicine, not as a food, as a medicine primarily.
So they basically have the same respect for accuracy, information dissemination, reliable products, safe products, and they use all of their beliefs of how you would handle a medication into creating this food supplement, but it's still classed as a food supplement.
Yes, it is still classed as a food supplement, absolutely.
Fine,
but it's a pharmacy grade food supplement that is produced under specific regulations.
Okay, and to be fair, because there is no financial exchange here, this is not an advertising for you.
No, absolutely.
The kindness of our own heart, trying to get you guys information. Are you the only, is this company only, or are there others that are also offering pharmacy grade?
I'm honestly not aware of other companies. There may be other companies, but personally, I'm not aware. And certainly, we were at London Vet Show. I think we were the only company there that were coming at it from a medicine point of view.
That is going to change because this is a lucrative market. And one of my friends has just come back from being over in America for a big equine conference. And he was just like, holy cow. It's in everything. It's in bedding, it's in coats, it's in everything. So we know that it is going to go nuts. But pharmacy grade, really, tightly regulated content. Okay, so we've kind of got there. I must admit, it's hard. It's really hard. It's I hope people realise with these episodes that Cam is not trying to be the fun police. We're trying to be honest, and we're trying to give you guys all the tools to make your own decisions. And we're going to end on a really positive note. And this applies to no matter what treatment you choose to pursue, is that you need to be objective about whether it's working. And this is what keeps me really engaged in CAM, is that it's about the dog. It's about the dog. And it's about making sure that this condition, whose major clinical sign is pain, that we need to make sure that pain is being controlled. And it doesn't matter whether you're using a non-steroidal, whether you're going down an adjunct opioid, an NMDA receptor inhibitor, physiotherapy, hydrotherapy, laser therapy, CBD, whatever pathway you're going down, we've got to make sure it's working. Because all of us are very, very prone to something called caregiver placebo, where we believe something's working because we so want it to work. There's also things called regression to the mean, because it's a disease that does this anyway. So are you starting your product when it was getting better anyway? And then the product wins that award and accolade when actually it didn't do very much. So we need to remember that we need to be objective and make sure our interventions are working. So if you are going to go down this route and you do it with your vet consent and support, still be objective. It's really, really important. Thank you, Siobhan. You're a legend. Legend. And I'm hoping to be in Ireland in the summer, so I'm going to come and find
Oh, excellent. You must come and visit.
I
feel old enough to be a legend.
No, you're not. You don't look it. So hopefully these will be well received, and I would love to get you back so that we can just stay up to date with what's happening in this field. But I don't want to just be CBD focused. You are eloquent and lovely. I would love you to come back and talk about all of the other multimodal approaches that you regularly do. Cam followers, say yay. Let's get Siobhan back and she can tell us about her work. So until then, thank you very much, guys.
Bye.